Well, at Counseling Services, we offer short-term individual therapy at low cost. Your first session is always free. First session is an intake. It really looks like a conversation with a clinician about your history, things you've experienced, things that continue to bother you, and kind of developing some goals for what you want to get out of therapy. So that's a free meeting. And then as part of that meeting, we establish a fee schedule that maxes out at $10 per session, but we don't have to charge if people can't afford it, because we don't want people to have to choose between therapy and food or fun or anything like that. And so that's primarily what we do at Counseling Services, individual work, but we also offer outreach events, like we've got a Punch Out Final Stress event coming up over the next couple of weeks to help people de-stress for finals with stress balls and frisbees and punch and coloring pages to kind of help take care of themselves, and we'll also be offering tips on stress reduction and stuff like that. So we pop up all over campus doing events like that. Usually about once a month there'll be some theme, and so we'll just show up and wait. We won't wait for people to come to us in our offices. Instead, we'll try to go where y'all are and give you some good knowledge and some tips. We also do mindfulness meditations every Wednesday, and we show up all over campus to just offer presentations wherever we're needed on how to cope with academic life, how to do things better, just anything that students feel like they're needing from us. We try to show up and provide that, and that's all free. We're also working on a couple of groups, getting groups off the ground here on campus. We've got one that's called Family Hour, LGBTQ Talk Time, for anyone in the LGBTQ plus community to just show up and feel like they can be their authentic selves, whether it's to talk about hard stuff or not. And we also have the recovery community that offers support for students in all stages of recovery from substances of drugs and alcohol and things like that. And so if people are wanting to make changes, not sure if they want to be completely sober, or if they know the sober life is something they need support on, we offer free groups to kind of help students get that support. Oh man. We liked our workshop schedules, which is going to be changing a little bit next semester, starting in fall 2017. We're going to be trying to partner with people on campus to offer those workshops. Rather than trying to get people to come into our doors, we're going to try to meet students where they're at. And so we've done a little bit of that with like multicultural student services and student retention services. And the great thing behind those workshops is instead of waiting for students to come to us, which can be a difficult step because we know there's a lot of in some communities stigma around mental health and seeking treatment, and some people are just not sure what therapy's like or if it's for them. And so kind of instead of waiting for them to feel that and come to us, we show up where they are, whether it's a class or a workshop offered through another student organization, and try to teach them the same skills that we teach in therapy, but instead of one-on-one to 15, 20, 30 people at once. And it's a nice proactive step for us as a counseling services center, but it's also really cost effective. Because if I can reach 20 or 30 people in an hour and teach them some great skills on how to change the way they deal with their emotions or tolerate distress better or whatever it is, that's more bang for UMSL's buck, so to speak. And so we really like developing that practice, in conjunction with our one-on-one work. We have relationship workshops, how to handle conflict, how to build a strong relationship, whether it's a romantic relationship or a friendship. We do stuff on how to deal with test anxiety. So some of them are just strictly just academic. Here's how to be a better student. Here's how to avoid the procrastination, perfectionism, anxiety cycle. We offer stuff around team building. We've worked with the Leadership Development Institute. I kind of feel like as long as we have enough notice, we can develop a workshop around almost anything and teach almost any skill that students feel like they're lacking. So that's the way a lot of these workshops have been developed. Is some entity on campus has come to us and said, hey, students are really struggling with a work-life balance, especially with demands of jobs and families and everything else that they're carrying. Can you come and talk to them about some ways to kind of manage that and still take care of themselves? And so we've had some really fantastic experiences kind of just meeting the campus needs as they arise. And so we're thrilled to do that. I think that's a really understandable piece. I don't think I don't think therapy is accurately presented in the media and movies, and so if you're trying to figure out if getting help is a good fit for you based on what you're seeing in that, I can understand some hesitancy. Some people are taught that getting therapy means you're weak and you should be able to handle this on your own, and that's a tough thing to struggle with when you're already feeling low enough that you're considering getting help. And so I would say I totally understand why someone might hesitate, and I think that's an important part of the conversation. And so one of the things I always talk with my clients about is, how does this feel? You know, what questions do you have for me? Because I want people to be able to address that and not feel like it's the elephant in the room. But I would say that just as you might go see a doctor, like a physician, if you're running a fever, or if you had a bone sticking out of your skin, that I would encourage people to think of their mental health in the same way. And that sometimes stuff happens to us and it overwhelms our skills, or we just need a little extra help talking about it and honoring what we're feeling. And just as if I hope no one would feel ashamed to go see a physician and get medication for a flu or some other kind of similar thing, I would hope people would be kind to themselves if they realized, you know what, I could do this easier and faster if I had a little help. Because struggling alone can be pretty painful, and having that person that can help you through that journey, that you're not going to have to see outside of therapy, that you're not going to have to wonder, can I trust this person? Are they going to tell our friends what we're talking about? Are they going to understand me? Like, that's a really special space. And so we encourage people to consider taking advantage of that, especially in college. Because like I said, our fees are really low. We're here on campus, and so that's pretty convenient. And that's not something you get pretty easily outside of your college years. So take advantage of it. See if it can help you.
Okay. What are some common issues you find college students struggle with?
Depression and anxiety are big ones. Depression, you can often recognize that if a couple of weeks of not feeling like yourself, feeling sad, crying, not liking the things you normally like to do, feeling really stuck. That's a big hallmark for depression. And if that lasts longer than just a couple of weeks and you're not just bouncing back on your own, especially if it's something you've continued to struggle with, it may be useful to come talk to somebody. Worst case scenario, you talk it through and you may feel better just talking about your problems, but there may be some skills you can pick up to learn how to interpret the world differently and tolerate distress better. And so sometimes people find that to be very helpful. Anxiety is another big bear, particularly on campus, because a lot of us are in high stress lives and we have a lot of demands, and they may exceed our coping skills. And so anxiety is a big skill-based piece, learning to approach what's scary and tolerate it and move forward rather than let anxiety make your world small. Those are big. And the other thing I'd say we see a lot is trauma. It's not uncommon for a lot of our students to experience some really painful stuff, to be experiencing some painful stuff that they need help coping with. And so we see that really frequently. But there's really not an issue that I think we haven't seen here at UMSL. We have a lot of really tough, courageous students that bring with them some pretty unique pain and are able to be great students and go on to have wonderful careers, but sometimes we're a stop for them to help them cope better. So while anxiety, depression, and trauma are common, we see it all.
Okay. Leslie, how can students get in contact or make an appointment?
It's easy. So all they have to do is call 314-516-5711 and just say, hey, I'd like to schedule to see a clinician. If they look at our bios and say, I think this person would be a good fit for me, or I've met this person and they seem really nice, they're free to ask for somebody. But we have an intake counselor that's really good at matching people. And so what happens is after they call, they're going to provide like kind of availability. This is when times are good for me. This is generally what I want to talk about. And they can go into as much detail or as little as they want. And then the intake clinician will call them back and match them with someone that fits their schedule and is kind of what they're looking for. And then that first session, like I said, is free, and it'll be a conversation about what's happened and what they can expect. And students can also walk right in and make an appointment. And if they're in dire need, like if it's a crisis, and that can look like I don't think I can keep myself safe, or I'm thinking about hurting myself or someone else, or I'm just having trouble functioning. We have students sometimes that they'll feel unable to leave the house, and that'll be a big motivator to maybe I should come in and see a clinician. And we'll encourage them to just come right down, and so we can start making a coping plan to get them back into their lives right away. And so call or come in and ask for an appointment, but we encourage people, if they're in enough pain that they're having trouble living their lives, or they're in danger, just come on in. We've always got somebody to talk. And worst case, we'll spend 15 minutes kind of talking things through and trying to make a plan. But often, you know, we find it's helpful to have something to do in the moment while you're in that much pain, so you can start feeling even a little better.